So, Lucas, don't you got better things to do than sustainable plastics and medical technology? It's all about patient safety. Nobody cares about saving the planet. I hear a lot of those things, and I want to lay out why I care about sustainable plastics and medical technology. First of all, I would like to say, this word sustainability that kind of degraded, and pretty badly so. I think that the word sustainability doesn't mean what it used to. I think it used to mean, and it was invented for, to be carried on into the future without detriment, meaning that it would be socially, environmentally, and economically viable for a long time. And I think it only means today to be ecologically sustainable. So it's better for the environment, and the environment will keep us going longer. And not to get me wrong, we're not doing too good on that front, but we need to take into account that, it's like good for our pockets and good for the patients is also key. We need to make it good for the planet, good for our pockets, and good for the patient. And a good medical device needs all of it to be successful and to be, to have a strategic advantage in the future. So we need all three of them. And I want to bring back the word sustainability to this. So yeah, I'll frequently use ecological instead of sustainable because eco also has this like negative connotation, but it is the correct word. It is the better word to use because like sustainable is gonna be used interchangeably with ecological, and we shouldn't do that. And now, why should we care about ecology? Why should we care about the third option? Because like the first two we're already doing. So we have two of three in line. I think there are four fundamental forces of sustainability ecology that are moving the medtech space. And the first is, investor pressure, self-commitment. Uh, Lots of companies have science-based targets, have sustainability targets, not only because of investor pressure, public pressure, but also because of ESG funds. You get better funding conditions if you are more sustainable. Then the second thing is going to be the customers. The customers, like hospitals, they care about sustainability. They have a little bit the different understanding of what sustainability means. So many meta companies think in CO2, they think in carbon, but the hospitals usually think in waste. They think in single-use waste. So the challenge they would like to have solved is, what do we do about the single-use waste? What do we do about all this liability, all this cost that we have associated with it, but still keep it convenient for us and keep it affordable for us? And many hospitals are incorporating sustainability criteria in their tenders now. So, like the NHS, for example, the Nordics. And these requirements are also varying. So, we're in a kind of, let's say, a finding phase. What are the requirements that everybody should be asking? Some think about recyclability, some think about substances of concern, some think about CO2 footprint. And so there's a variability of what you're getting asked from your customers. And then currently we have the question, okay, do we buy the device or do we don't buy the device? Because there's nothing really sustainable as an alternative out there. And then the competition starts to get in. If everybody says, no, it's impossible, we can't do it, we can't change your product, it's impossible because sustainability is just too difficult or nobody cares, then the customer has the choice, do I buy a surgical device or do I don't? But as soon as someone starts to break line, like an avalanche starts, you know, if someone has something that has sustainability claims, that has bio-based materials, that has recycling, that is a hybrid use device, that has advantages in terms of efficiency, in terms of material use, in terms of CO2 footprint, then what you see is, the line breaks because the hospital now has the choice and they can tell you, oh, your competition is doing it. Why aren't you doing that? And that is going to cause a FOMO, fear of missing out in your company. And you will no longer ask, but is the market going to adopt it? Can we sell it? It's like, that's not a question anymore. Your competition is selling it. So you do know that it's sellable, but you now have to catch up And that is really bad position to be in, because you have 2 or 3 years to develop a device, and your competition has free reign on those 2 3 years to win some tenders. And those who are not moved by investors, by competition, by the customers, they will be moved by regulations. I think that you have one generation of product left that you can develop without sustainability in mind. You can't get away with it for one product generation, but like 2030 onwards is going to be mandatory. Like the PPWR is hitting this year in 2026, but it's like that's only the tip of the iceberg. There's a lot of more regulations coming, and I think the biggest one is going to be the Eco Design for Sustainable Product Regulation. As soon as that hits for medtech, it's going to be the MDR on steroids. It's like people are going to freak out, and it's going to be a massacre. If you don't know about eco design, you can't calculate an LCA, you have no structured material selection process, and you ran on the default of we have always done it like this, or our supplier did suggest that material, then you're going to be in big trouble. And this is why I think you should do something about it. But let's elaborate a little more why you should care about the materials so much. You know, these are the medtech companies that have pledged to reduce their scope 1, 2, and 3. So their direct, indirect, and supply chain emissions. And I got to this slide with the following method. You take the biggest medtech companies in the world, you go through it, check who has a science-based target initiative commitment or validated targets, and then you list them. 49 of the 100 biggest medtech companies do so. This is 330 billion turnover-ish, which is roughly 60% of the medtech market. Like depending on which year and depending on which market numbers you believe. But medtech is committing to sustainability. It's a little slower, but it's getting there. And then, these commit to also force their suppliers to do so. Meaning, if you're supplying one of these companies, guess what? They're going to start asking about scope 3, about your materials, about what your CO2 footprint is going to look like. So you're in the same trouble as they are. But, we're all implementing our electric cars. We're implementing our solar panels. And we're doing recycling programs for our factory waste. Yes, that is good. But, it's like that's not the biggest part. The biggest part, and this is from Swiss Medtech Net Zero Roadmap. So they did a survey with medtech companies in Switzerland, and they did the scope 1, 2, 3. So direct, indirect emissions. So this is scope 1 and 2. So your green energy, your electric cars and all that stuff, and that's 5%. And 95% is scope 3. The biggest subcategories of this is scope 3.1, purchase goods and services, aka materials that you use. And then 3.11, which is use phase. So if you have a medical device that is a ventilator, it's usually 10 times more carbon intensive to run that ventilator than to create it. It's like 250 kilos of CO2 roughly for a ventilator, and then 2.5 tons of CO2 to run it over its lifetime. So it's much better to focus on the energy efficiency on a ventilator. And if you're doing consumables, like a surgical device, like a ventilation circuit or whatever, then it's going to be the materials. The materials that you use are going to be the biggest lever. And this is like 48% of all medtech in Switzerland, in Astersis, is caused by the materials used. So it's the biggest lever next to use phase. So those are the two things that you should do. If you do an electrical medical device, focus on energy efficiency. If you do consumables, focus on the materials. Use less materials, use better materials. And that you can do by building expertise, by implementing an eco design process, by implementing a structured material selection process. And if you get that right, if you can calculate an LCA, select materials properly, and do eco design, you're ahead of the curve. You're like better than 95% of medtech. And you're not going to get crushed by the regulations. And the others will. So you have free reign after that. If you want help with doing that, we have this online learning platform, the GradeMatch program. It's an online learning platform. Your engineers can learn at their own pace about plastic selection, about LCA, about eco design and all that good stuff, and what sustainable plastics are out there. there's this is a huge bundle. It's also giving you our process of how to select plastic. It includes one-to-one coaching. So if this sounds interesting to you, we should maybe talk. And if you want to talk to me, or if you just have questions about a video about or about plastics and medical technology, sustainability, material compliance, you can scan this code and I'll give you 45 minutes for completely free. You show up, you ask some questions, and I'll answer them within the 45 minutes. It's very easy. You scan that, you get a Calendly link, you select the time that works for you and for me, and then we will chat. And I'm very much looking forward to that. Good. So if you want to help me or you want to help yourself, like, comment, and subscribe, because YouTube likes those things and it will show you more of these videos and more of my videos in the future. So if you do that. If you have a question for a specific topic, or if you want to have a suggestion of the video, just drop it in the comments. And thank you very, very much for watching, and until the next time.